Good evening, guys. Tonight's discussion D, we are discussing how caffeine lowers your dementia risk. So here we go with the presentation I made for you. Sit back and enjoy, please. Okay, moderate daily caffeine, roughly 2 to 3 cups of coffee or 1 to 2 cups of tea, is associated with a modest but measurable reduction in dementia risk and slower cognitive decline over decades. It's not a cure, but it's a practical low cost piece of a broader prevention strategy. Quick guide: key considerations before you change practice or policy. Evidence strength: large, long running observational cohorts show associations, not causation. Dose: benefit concentrated at 2 to 3 cups of coffee a day or 1 to 2 cups of tea a day. More isn't clear. More isn't clearly better. Who who to exclude? People with uncontrolled arrhythmias, severe anxiety, or medication interactions. Tailor guidance individually. There is a particular kind of hope that arrives quietly, not as a headline about a miracle drug, but as a steady accumulation of evidence that everyday choices matter. The recent Harvard led analysis of more than 113 or 130,000 participants followed for decades after or offers exactly that, a signal that the ritual many of us already practice may also help preserve the mind. What makes this study persuasive is scale and time. Repeated dietary um, assessments across the nurses' health study and health professionals follow up. Study allowed researchers to link long-term patterns of, of caffeinated beverage intake with later life cognitive testing and dementia diagnoses uh, over up to 4 decades. The headline finding: about an 18% lower dementia risk among people drinking roughly 1 or 2 to 3 cups of caffeinated coffee daily is most is modest in isolation, but meaningful at population scale. Biology gives the association plausibility. Caffeine and consumption, polyphenols, Coffee and tea have been shown in laboratory and animal work to reduce neural inflammation, protect neurons from metabolic stress, and influence amyloid pathways. Implicated in Alzheimer's disease. These mechanisms do not prove that a morning cup prevents dementia, but they make the epidemiology epidemiology signal less surprising. Policy and clinical practice should treat caffeine as an adjunct, not an answer for public health messaging and long-term care nutrition standards, recommending moderate caffeine beverages as part of a healthy aging toolkit is reasonable, provided guidance is individualized and balanced against cardiovascular, sleep, and psychiatric considerations. Facilities can safely offer caffeinated options and educate residents and families about moderation and contradiction. Risks and limitations. The study is observational. Residual confounding is possible. Caffeinated drinks showed no benefit, and excessive caffeine can worsen sleep, blood pressure, and anxiety. Any policy should emphasize moderation.400 avoid 400 milligrams day for most adults, and pair caffeine guidance with proven prevention strategies. Physical activity, vascular risk control, sensory care, and social and cognitive engagement. This is the kind of finding that changes conversations more than it changes prescriptions. It gives clinicians and caregivers a concrete, low cost talking point and gives the public a small, actionable habit to fold into lifetime of brain health choices. In the slow work of preventing dementia, small, sustainable shifts, a cup of coffee shared at breakfast, a tea break with a friend may add up to real difference. Moderate daily caffeine, about 2 to 3 cups of caffeinated coffee or 1 to 2 cups of caffeinated tea, is associated with a modest 18% lower risk of dementia and slower long-term cognitive decline. In large decades long cohort studies, the evidence is observational and best treated as one practical piece of broader prevention strategy. Why this finding matters now. The new Harvard analysis lands at a moment when dementia prevention is shifting from vague aspiration to actionable evidence grounded practice. Drawing on the nurses' health study and the health professionals' follow up, study researchers followed 131,000 adults for up to 43 years, repeatedly measuring diet and linking those patterns to later cognitive testing and dementia diagnoses. That kind of longitudinal death is rare and powerful. Across these decades, a consistent signal emerged. People who drank 2 to 3 cups daily of caffeinated coffee or 1 to 2 cups daily caffeinated tea had a lower likelihood of developing dementia. The effect wasn't dramatic, but it was durable. And importantly, decaffeinated beverages showed no clear benefit, suggesting that caffeine and the bioactive compounds that travel with it may play a meaningful role. What the science suggests but does not prove. Researchers are careful not to overclaim. Still, several biologically plausible pathways help explain why coffee or caffeine might support long term brain resilience, reduced amyloid beta accumulation, a hallmark of Alzheimer's pathology, lower, neuro, lower neuroinflammation, which is increasingly recognized as a driver of cognitive decline. Improve vascular and metabolic function, both essential for healthy brain aging, antioxidant and neuroprotective effects from polyphenols naturally present in coffee and tea. These mechanisms don't prove causation, but they make the epidemiology signal more credible, especially when observed across such large diverse cohorts. Practical takeaways for readers and policymakers. Moderation matters. The protective association clustered around 2 to 3 cups of caffeine daily, where was more wasn't better. and too much can undermine sleep and cardiovascular stability. Caffeine is an adjunct, not a replacement. It should sit alongside proven dementia prevention strategies, physical activity, blood pressure, and diabetes control, hearing care, sleep hygiene, and social cognitive engagement. Individualized guidance. People with uncontrolled arrhythmias, severe anxiety, insomnia, pregnancy related restrictions, or medication interactions may need to limit caffeine despite population level benefits. Risks, limitations, and responsible messaging, observational design, even with decades of follow up, residual confounding remains. Possible coffee drinkers differ from non-drinkers in many lifestyle factors. Excessive caffeine can worsen sleep, raise blood pressure, and intensify anxiety. Public guidance should emphasize staying below 400 milligrams for most adults and avoiding late day consumption. Equity and access. Caffeine and coffee and tea are widely available, but messaging must be culturally sensitive and avoid implying that caffeine is a universal or primary prevention tool. A policy minded conclusion. This study doesn't promise miracles, but it does offer a low cost, scalable, culturally familiar level for improving brain health across populations for clinicians, caregivers, and long term care leaders. Moderate caffeine, moderate caffeinated coffee or tea can be woven into prevention toolkits with clear conveys and individualized guidance for communities. It's a reminder that small daily rituals can accumulate into meaningful long term benefits. Okay, guys, that's it for tonight. I will see you guys tomorrow for shows. Until then, get her wellness. Take care, folks.